Kayod kabayo, ika nga nila. Masisipag tayong mga Pilipino, alam natin yan. Ngunit ngayon, sa gitna ng isang pandemya, habang ang mga presyo ay nagsisitaasan, habang ang normal na kabuhayan ay biglang nahinto, ang huling nanaisin ng isang Pilipino ay magkasakit, maospital, at lalo na't gumastos. Sa gitna ng pandemyang nararanasan ng buong bansa, anong tulong nga ba ang pwedeng makuha ng maralita? Nakapaloob sa ating batas ang pagkakaroon ng isang programang matutugunan ang ating pangangailangan ukol sa mga isyong pangkalusugan. Ang aming video ay naglalayon na magbahagi ng impormasyon ukol sa isang batas na naglalayong matugunan ang nasabing suliranin. This is Fatima Mae Asani, and this is what we should know. Section 11, Article 13 of the 1987 Constitution of the Philippines, which is entitled Health, provides, the state shall adopt an integrated and comprehensive approach to health development which shall endeavor to make essential goods, health, and other social services available to all people at affordable cost. There shall be priority for the needs of the underprivileged, sick, elderly, disabled, women, and children. The state shall endeavor to provide free medical care to paupers. So right now, the question is, where are we Filipinos?
Health is one of the most important, if not the most important topic for any population or individual. In 2019, our legislators passed the Universal Healthcare Act, or Republic Act 11223. The landmark law expands access to health services by automatically enrolling all Filipinos in PhilHealth National Health Insurance Program. It seeks to ensure that all Filipinos have comprehensive access to all sets of health services without financial hardships. According to our Socio-Economic Planning Secretary, Ernesto Pernia, our medium-term plan recognizes human development not just as a means of economic development, but as an end in itself. That is why the signing of the UHC law is a victory scored for the health sector. We are glad that we have reached this milestone. President Rodrigo Duterte, in signing the law, said that by automatically enrolling our citizens into the National Health Insurance Program and expanding the PhilHealth coverage to include free medical consultations and laboratory tests, the Universal Healthcare Law that I signed today will guarantee equitable access to quality and affordable healthcare services.
Republic Act No. 11223, or commonly known as the Universal Healthcare Act of the Philippines. The Universal Healthcare Act is an integrated and comprehensive approach to ensure that all Filipinos are health literate, provided with healthy living conditions, and protected from hazards and risks that could affect their health. It is a healthcare model that provides all Filipinos access to comprehensive set of quality and cost-effective, promotive, preventive, curative, rehabilitative, and palliative health services without causing financial hardship, and prioritizes the needs of the population who cannot afford such services.
The law will cover every Filipino citizen and shall be automatically included into the National Health Insurance Program, that is the population coverage. In terms of service coverage, every Filipino shall be granted immediate eligibility and access to preventive, promotive, curative, rehabilitative, and palliative care for medical, dental, mental, and emergency health services delivered either as population-based or individual-based health services, provided that the goods and services to be included shall be determined through a fair and transparent health technology assessment process. The Department of Health and the local government units shall endeavor to provide a healthcare delivery system that will afford every Filipino a primary care provider that would act as the navigator, coordinator, and initial and continuing point of contact in the healthcare delivery system, provided that except in emergency or serious cases and when proximity is a concern, access to a higher level of care shall be coordinated with a primary care provider, as every Filipino shall register with the public or private primary care provider of choice. The Department of Health shall promulgate the guidelines on the licensing of primary care providers and the registration of every Filipino to a primary care provider.
You might be wondering what's the difference between the previous one. Before, you have to show your card, you have to be a member. Now, you just have to be Filipino citizen, and that is what the universal dream means as far as our country concerned. Before the permitted law or the devolution law, local government code, it was centralized. So all health services came from our lead health system, which is the Department of Health. Now the services of the healthcare system are given to the local government units.
Some people say it's fragmented. Some people say it's decentralized or bringing the healthcare system closer to the people. It depends upon the perspective. It has its own advantages and disadvantages. If you have the managerial and administrative process in the local setting, then it will work. However, we have to remember that not all local government units are rich or first-class municipalities. Municipalities are categorized from first to sixth classes, the fifth and the sixth classes being the poorest, and the first class being the richest. The income and resources are not the same. With income comes resources, equipment, and even the skills needed. And there is the tendency to go to the more populous areas. The Universal Health Care Act is the progressive effort to the government. It is created to provide a framework of healthcare system that is affordable and equitable.
So to answer the question presented, what program can help Filipinos in terms of health-related issues? This is the answer. The universal healthcare with its disadvantages and advantages. This is a progressive move of the government. Some may criticize its implementation, some may scrutinize every detail. But we as law students, we must be critical, at the same time rational. After all, it's not about who sits and who leads. We shall go back to the main purpose of social legislation, and that is to change and reorganize by improving the social and economic condition. Each individual of this society has to be given equal rights and equal opportunities. I hope that you've learned something with our video. Thank you so much, and once again, God bless.